Welcome to Wise Words, a channel dedicated to bringing you essential health insights that can significantly impact your life. Have you ever experienced an itch that just won't go away, no matter how much lotion you apply? It might seem trivial, but don't ignore it. Your body often has its own way of sending warning signals, and sometimes a persistent itch isn't just a sign of dry skin. It could be a hint of something much more serious. Today, we're diving into a crucial topic that affects many seniors: the 5 specific itchy areas on the body that could indicate underlying health conditions. According to Dr. Sarah Mitchell, a geriatric specialist with over 30 years of experience, these areas can reveal significant health issues that, if left unaddressed, may shorten one's lifespan. By recognizing these warning signs early, you can take proactive steps towards better health and potentially add years to your life. In this video, we'll explore each of these 5 itchy areas, discussing the possible health implications associated with them. We'll share real-life stories of individuals who ignored their symptoms, only to discover serious health concerns later on. These stories not only illustrate the importance of paying attention to our bodies, but also serve as a reminder that what may seem like a minor annoyance could actually be signaling something much more significant. As we progress through the video, we'll also emphasize preventive measures and lifestyle changes that can help seniors maintain their health and well-being. To enhance your understanding, we'll include helpful illustrations and visual aids, making the information more engaging and easier to grasp. Let's begin our exploration with the first itchy area: the feet and ankles. You might not think much about these parts of your body, but they can be crucial indicators of your overall health. Persistent itching in your feet and ankles can signal serious underlying health issues that require your attention. When you experience an itch that lotion just can't soothe, it's essential to pay attention. Dr. Sarah Mitchell explains that this persistent itch could be a sign of poor circulation or fluid retention, both of which are common among seniors. Poor circulation, often caused by a condition known as peripheral artery disease, PAD, can lead to inadequate blood flow to your extremities. This lack of circulation can make your skin dry and itchy, and unfortunately, nearly 1 in 5 Americans over the age of 70 has PAD without even realizing it. The implications of ignoring this symptom can be severe. Dr. Mitchell warns that individuals with PAD are at a significantly increased risk of heart attack and stroke, up to 5 times greater. If you notice that your feet feel persistently itchy and perhaps even swollen, it's crucial to consult a healthcare provider immediately. Another serious condition linked to itching in this area is fluid retention, or edema. If you find that your socks leave deep impressions on your ankles or your shoes feel tighter throughout the day, this might indicate that your heart isn't pumping efficiently, leading to fluid buildup in your feet and ankles. To help alleviate some of these symptoms, Dr. Mitchell recommends a few simple steps. Elevate your feet above heart level for about 20 minutes 3 times a day. You reduce your salt intake and keep track of when the itching is at its worst. Paying attention to these signs can be life-saving. Turn our attention to the second itchy area: the hands and fingers. Our hands are vital tools that tell the story of our lives. They've held loved ones, created meals, and built precious memories. However, when persistent itching occurs in this area, it may be your body's way of signaling an underlying health issue that needs attention. Dr. Sarah Mitchell emphasizes that many seniors often overlook itching in their hands, assuming it's just a normal part of aging or dry skin. However, this persistent itch can indicate 2 serious conditions: kidney disease and diabetes. These conditions can progress silently, making it even more crucial to recognize early signs like itching. When it comes to kidney disease, the connection might not be immediately obvious. As the kidneys begin to fail, toxins can build up in the bloodstream, leading to a condition known as uremic pruritus. This intense itching often feels as if it's coming from deep within the skin, and it can significantly affect your quality of life. Dr. Mitchell has seen many patients, like Robert, a 72-year-old carpenter, who initially dismissed his itching as a side effect of his work. But when he finally sought help, blood tests revealed dangerously low kidney function. Early intervention not only stabilized his condition, but potentially added years to his life. Diabetes is another concern linked to itchy hands. Elevated blood sugar levels can cause nerve damage, particularly in the extremities, leading to sensations of tingling, numbness, and persistent itching, especially at night. Dr. Mitchell shares the story of Virginia, a 68-year-old teacher whose nightly itching drove her to seek medical advice. Testing revealed previously undiagnosed diabetes, allowing for timely management of her condition. If you find yourself experiencing persistent itching in your hands and fingers, particularly if it worsens at night or doesn't respond to moisturizers, it's important to consult your healthcare provider. Pay attention to any additional symptoms, such as increased thirst or fatigue, as these could provide valuable information to your doctor. Focus on the third itchy area, the shins. This often overlooked part of the body can reveal crucial insights into your health, particularly as you age. Persistent itching in your shins may not just be a minor annoyance, it could signal serious underlying circulation problems that require your attention. Dr. Sarah Mitchell explains that the skin on your shins is uniquely vulnerable. It's thinner than on many other parts of your body, has fewer oil glands, and is supplied with less blood. Because of these factors, the shins can serve as an early warning system for various health issues, particularly those related to circulation. One of the most concerning conditions linked to itchy shins is peripheral artery disease, or PAD. PAD occurs when arteries become narrowed due to plaque buildup, impairing blood flow to your legs. When blood cannot circulate properly, it can lead to dry, itchy skin that may also appear discolored. Dr. Mitchell points out that nearly half of seniors with PAD are unaware that they have it. Ignoring symptoms like persistent itching could have dire consequences, as untreated PAD significantly increases the risk of heart attacks and strokes. Dr. Mitchell shares the story of Margaret, a 78-year-old woman who noticed constant itching along her shins during her weekly bridge games. Despite trying various lotions, nothing seemed to help. Upon the advice of a nurse friend, she sought medical attention, leading to the diagnosis of significant PAD. With appropriate treatment, including medication and lifestyle changes, Margaret was able to improve her symptoms and enhance her overall health. Another condition that can manifest as itching in the shins is venous insufficiency. This occurs when the valves in your leg veins fail to function properly, causing blood to pool and leading to swelling and discomfort. If you notice persistent itching along with changes in your skin, such as unusual dryness or color variations, it's crucial to discuss these symptoms with your doctor. Delve into the fourth itchy area, the neck and jawline. Many seniors pay close attention to the appearance of this region, often associating any changes with aging. However, persistent itching in this area should not be ignored, as it may indicate underlying health issues related to thyroid function. Dr. Sarah Mitchell explains that the neck houses the thyroid gland, a crucial organ responsible for regulating various bodily functions, including metabolism and hormone production. When seniors experience persistent itching around the neck and jawline, especially when typical moisturizers fail to provide relief, it can be a sign of thyroid dysfunction, particularly hypothyroidism. Hypothyroidism, which affects nearly 10% of Americans over the age of 65, can lead to various symptoms, including fatigue, weight changes, and, importantly, dry and itchy skin. The skin's inability to retain moisture is a common complaint among those with thyroid issues, and the itching sensation often occurs near the gland itself. Dr. Mitchell recounts the story of Dorothy, a 69-year-old retired librarian who visited her office due to persistent itching in her neck and jawline. Despite trying different creams and changing her laundry detergent, nothing seemed to help. Accompanied by feelings of fatigue and cold sensitivity, Dorothy's symptoms prompted Dr. Mitchell to conduct a thorough evaluation. The results revealed significant hypothyroidism, leading to appropriate treatment that transformed Dorothy's quality of life. Within weeks of starting medication, she reported not only relief from itching, but also a return of her energy and clarity of thought. Another potential cause of neck itching is autoimmune conditions such as Hashimoto's thyroiditis, where the immune system attacks the thyroid, leading to inflammation and discomfort in the surrounding skin. If you notice persistent itching in your neck or jawline, especially if it accompanies other symptoms like fatigue, weight fluctuations, or mental fog, it's essential to consult your healthcare provider. Early detection of thyroid issues can lead to effective treatment and improve overall health. Explore the fifth itchy area, the back. While it might be easy to overlook, persistent itching across the upper or lower back can signal serious internal health issues that may affect your longevity. This large area of your body, often out of sight and hard to reach, can provide critical clues about your overall well-being. Dr. Sarah Mitchell explains that itching on the back can be linked to two particularly concerning conditions: diabetes and liver disease. As one of the most common symptoms among seniors, itching can arise when blood sugar levels remain elevated, damaging nerve fibers and affecting sweat gland function. Many patients describe this type of itching as a deep, irritating sensation that seems to come from within the skin, particularly in areas that are difficult to see without assistance. Dr. Mitchell shares the story of James, a 74-year-old retired school principal who enjoyed gardening until persistent itching across his lower back began to interfere with his hobby. Initially, he dismissed the itch as a reaction to his gardening clothes or heat rash. However, when the itching worsened, he mentioned it during a routine checkup. Comprehensive blood tests revealed elevated blood sugar levels, indicating previously undiagnosed type 2 diabetes. With proper treatment and lifestyle adjustments, James managed to get his diabetes under control, and the itching subsided significantly. In addition to diabetes, itching on the back can also be a sign of liver disease. When the liver is not functioning properly, bile salts can accumulate in the skin, leading to intense itching that often worsens at night. This can be particularly concerning, as it may signal conditions such as hepatitis, cirrhosis, or, in rare cases, liver cancer. These conditions can dramatically shorten lifespan if not addressed promptly. If you experience persistent itching on your back, especially if it's accompanied by other symptoms like yellowing of the skin or eyes, unusual fatigue, or unexplained weight changes, don't hesitate to consult your healthcare provider. Early intervention is key to managing these potential health issues effectively. As we wrap up our discussion today, let's take a moment to reflect on the 5 critical itchy areas we've explored: the feet and ankles, hands and fingers, shins, neck, and jawline, and finally, the back. Each of these areas can provide vital clues about your health and may indicate underlying conditions that could affect your longevity. It's essential not to overlook these signals from your body, as they often serve as early warnings of more serious health issues. Dr. Sarah Mitchell has emphasized throughout this video that persistent itching is not just a minor inconvenience, especially for seniors. It can be a sign of conditions like peripheral artery disease, kidney disease, diabetes, thyroid dysfunction, and liver problems. By recognizing and understanding these symptoms, you can take proactive steps to seek medical attention and potentially prevent more severe health complications. The stories we shared today, like those of Elizabeth, Robert, and Dorothy, highlight the importance of listening to your body. Each of these individuals initially dismissed their symptoms, thinking they were just part of aging or daily life. However, by seeking help, they were able to uncover serious health issues and take action before it was too late. Their experiences remind us that early detection and intervention can make a significant difference in our health outcomes. In addition to recognizing these warning signs, we also discussed various preventive measures and lifestyle changes you can implement to maintain your health. Simple actions, such as elevating your feet, monitoring your diet, and getting regular checkups, can go a long way in enhancing your quality of life. We encourage you to stay vigilant about your health and to pay attention to any persistent itching or unusual symptoms. If you notice anything concerning, don't hesitate to consult your healthcare provider. Your health is valuable, and addressing these issues early can lead to a longer, healthier life.